Hi everyone, this is Mr Neel Raithatha, also known as the Wax Whisperer. Thank you for joining me in my latest video. So this is of a patient who attended with bilateral. So the term bilateral in reference to ears means both ears. Fully occluding, soft, impacted earwax, and this is the patient's left ear. Now what made this procedure slightly more complicated than the norm is that the patient was in their wheelchair and we performed the procedure whilst the patient was in the wheelchair. On occasions, patients are able to transfer from the wheelchair to our ENT chair, but in this instance, it was just a bit too much of a problem for the patient because of their poor mobility. So we opted to perform the procedure whilst they're in the wheelchair. The reason why that made it a bit more complicated was that our ENT stool that we use, the adjustable stool that I sit on, I wasn't able to lever it down low enough to get the same height. So this procedure I actually performed with one knee on the floor, and I was crouching and performing it because in that way it allowed me to get to eye level. And I've done it several times before, but that's, as an ear care specialist, that's something that we have to be able to adapt to the different scenarios, different patients we're treating. So we're just removing this. So it's really sticky. There's a lot of keratin here as well. So I just put some olive oil spray in there just to help to lubricate not only the inside of the suction probe so it doesn't get blocked with the wax, but also lubricate the ear canal. And olive oil spray, olive oil, not spray but drops, it has a binding effect. So it helps to bind the wax together, similar to an egg in a potato cake or fish cake recipe. So it comes out in larger chunks. So the patient's got a narrowing at this point. This is probably halfway into the ear canal. And you can see the ear canal narrows and it widens again. And this wax has been there for a while. It's oxidized, it's quite dark. You can see the ear canal veers off to the left, so they have got quite a prominent second bend. So our ear canals, they're curvy, bendy, twisty. There's normally two bends. So the ear canal takes the shape of an S if you're having a bird's eye view. And the first bend is about a half a centimetre into the ear canal, and the second bend is a further half a centimetre away. And that the second bend is where the bony part of the ear canal, so the rigid portion of the ear canal, meets the cartilage portion of the ear canal, which is the flexible part. So after the second bend, it's all bone, skin on bone, and it's very sensitive. So we're working on that portion now. So we're just past the second bend now. Just going to come out, just going to clean the lens and put loads of oil in the ear so it can get blurry at times. And you can see there's a few hairs in this wax, so that's another trait. As we get older, our ears become hairier. I'm laughing because I'm kind of giggling to myself because I'm at that age now where, not all men, but I would say a large percentage of men begin to lose hair in certain parts of their body. So in my case, the crown area at the back of my head. But you start having hairs growing in parts there you don't want it, so i.e. the ears. So is life. You can see this wax is really sticky. It's almost like a chewing gum consistency. And we're right up against the eardrum now. Now, I don't know how deep this last layer of wax is. I don't just want to poke and prod with the sucker because I don't want to go through the wax and impact on their eardrum and cause trauma. So I'm just trying to sparring with this wax, just delicately hovering over the surface of it. You see it's almost there now. And so despite this patient having a bendy ear, you can see how I've navigated into the ear to make it relatively quite straight now. So that's a technique with an endoscope that you have to develop. And it can be a bit tricky with an endoscope because the normal way audiologists and ear specialists look in the ears using a specular. So the specular is like a black cone, funnel-shaped object, and we insert that into the ear, and then we can use the specular to then manipulate the cartilage portion of the ear canal, so the outer third. So to almost rotate and twist and contort the cartilage portion, straighten it so it's in line with the bony part of the ear canal, so we can have a clear view of the eardrum. So I've always been trained, all audiologists are trained with speculums, we're using an otoscope. But with an endoscope, we're not using a specular because you can't really attach, well, you can potentially attach a specular to an endoscope, but then you take away the advantage of an endoscope, which is this, it's the view it provides, it's unparalleled. But so in the case of a bendy ear like this, we're having to use the endoscope to stretch and straighten the ear and simultaneously remove the wax using the instrument in the opposite hand. And it's quite a tricky skill at first to acquire, especially if you've got a narrow bendy ear. And that's why I've developed the wax scope. So if you're a keen follower of my channel, you may have heard me talk about the wax scope. There's a couple of videos on this channel of the wax scope, but if you want to learn more of the wax scope, please visit my other channel, the clear wax channel. So just type in clear wax into YouTube and you will see another YouTube channel where I'm more regularly updating videos and procedures taken with the wax scope. So the left ear was complete. There was a bit of dampness, wetness around the edge. We left that. It's not going to affect the patient. The symptoms are alleviated, and yeah, we're just moving on to the right. So this right ear, I don't know if you've noticed there, the entrance is so narrow. And this is where it can be a bit tricky with the endoscope for some people because we're having to use the endoscope to stretch this ear entrance open. So it's not only allowing us to visualize the inside of the ear with the endoscope, but then to insert the instrument. So with the wax scope, it's a bit easier to use because with the wax scope, it's got a specular attachment and you use the speculum to stretch and straighten the ear. So it's a bit more user-friendly. So we're really hoping that the wax scope is a bit more universal, university-friendly, should I say. And we've had a lot of interest and we're just waiting for a launch date. I was hoping to have it early autumn, but we might have to push it back by a few weeks. Just in this present climate around the world with inflation and to reduce productivity, there's a few obstacles we just have to overcome, a few delays, supply chain issues, but we're getting there. So we're hopefully not too long before we launch it. So again, I've put loads of oil in here and I managed to just ask the patient to tilt the head over slightly so the oil's still remaining in the ear and I'm suctioning at the same time. And I just came out a moment ago because it was just getting a bit too blurry, so I just wiped the lens of the endoscope and I'm just going back in and I'm just trying to loosen this. You can see I've just loosened it. Now, we've mobilised this plug. The difficulty now is to get it out this entrance because, as I mentioned, this entrance is completely shut, it's collapsed. So, as I mentioned, the outer part of the ear canal is made of cartilage, and over the years, this cartilage can weaken and gravity then takes its effect and it can cause the cartilage near the entrance to collapse. You can again see how narrow that is. Similar to the cartilage on our nose. So with our nose, it's the opposite to the ears as such. So the upper third of the nose is made up of bone and the lower two parts of the nose is made up of cartilage. And so is the tip. And over the years, the tip can weaken with gravity and it can droop. You can get a droopy tip. And in the same way, the cartilage in our ears can weaken and collapse. And that's what's happened with this patient. But we're getting there now. I'm just going to wriggle this out of the entrance. And we know we're at the entrance now because you can see there's hairs. So again, I'm just stretching the ear open. See, if I didn't stretch the ear open with this particular patient with the endoscope, then it wouldn't have been possible to insert the instrument in. So because of the drops as well, it's just softening this wax, so it's just breaking up into little pieces. We're just teasing this through. It's going to come out in a large lump, this is. It's just got a bit blurry because of all the hairs and the oil, but there we are. Just managed to prise this out of the ear. Now we're just going to go back in and look at the patient's eardrums, nice and healthy. Again, just going to wipe the lens just to avoid the hair so I can just get a better view. Well, I hope you enjoyed that video, guys, and I hope you're all keeping well and safe. And do take care of yourselves, and remember to be nice and be kind to each other. Thank you. Bye.